Hi, good morning, everyone. Welcome to 148th weekly session. We are live on CMAAO, an international medical association body of about 19 associations. We meet mostly every week and come on an important topic. We bring the experts to discuss. And today, I think we have a very, very important topic, anxiety disorder. At some point of time, I think everybody, especially after COVID, has been facing this problem. And we have an expert to discuss on this. We have Dr. Rahul Khemani talking about it. He is an MBBS, DNB for psychiatric. He's a consultant. He's a consultant at Heart and Mind Clinic in Mumbai. We all know about anxiety. It's a fear, fatigue, uneasiness, which we might cause in a daily life. We might see ourselves sweating, feeling restless, tensed, or even we have a palpitation or a rapid heartbeat. It can be a normal reaction, but we all usually get it mixed with some medical problem. We have a difficulty to work, we have a difficulty to breathe, difficulty to even sleep. So a wonderful topic for everyone. I would like you to write your questions in the chat box, or once the session is completed, we will ask you to ask your questions directly from the expert. Over to you, Dr. Rahul.
Thank you, Saurabh, and thank you for the introduction. And let me just share my screen. And good morning, everyone. Today, I will be speaking on anxiety disorder. This is a very, as Dr. Saurabh was speaking about it, a very important topic because this is something that we have experienced once in a while in our lives. But whether this becomes a problem, this hampers our day-to-day life, is to be understood how and what should we do about it. I am Dr. Rahul Khemani. I'm a consultant psychiatrist. I've been practicing in Mumbai at Heart and Mind Clinic in Borivali since the last many years now. And y'all can put in your questions in the chat box while the presentation is going on. Also, y'all can ask me after the presentation too. So to begin with, a basic outline will be understanding the demography, the signs and symptoms, on how to diagnose, and finally, the management. So, a basic definition of anxiety is that it's a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Now, this is important, this part, because if you're having anxiety, but it is not interfering in any way of your daily pattern, you're going through your day very regularly, very normally, and you're able to get up from the time that you wake up in the morning and sleep at night very smoothly, then it is not going to lead to a disorder. It will be anxiety, yes, but that anxiety will be a normal anxiety. This feeling of worry, fear, restlessness, uneasiness, something that you can't describe. It's a very free floating feeling. It's a feeling that you know it's there, but you can't pinpoint where it is. And that's why it is a mental health disorder. So, mental health is the health of the mind, just like physical health is the health of the body. The prevalence is almost 3 out of 10 people in this world, or almost 33% currently. And in 2019, it was seen in 301 million people, while in India itself, it was 44.9. It's quite uh, often seen that it's more common in females. The reason they have felt is related to the hormones, as estrogen is connected to depression and anxiety more as compared to testosterone. Why are we worried about anxiety? If it is, even if it is there, what should it? It's just a restlessness. We are worrying about anxiety because it has led to the ninth most common cause of disability. Means people are not going to school or college or offices because of this condition. So this condition stops you from getting to work, not allowing you to earn your livelihood. It is at the same time stopping you from connecting with your friends, with your family members, and you're not able to naturally just feel comfortable. Can everyone hear me? Is there
Yeah, your voice is perfect.
okay, great. So that is the reason why we should worry about anxiety. We should work on anxiety, and we should just try to solve this problem as quickly as it comes. So, to give a perspective over this, it's normal to have some anxiety. You can feel anxious or nervous when you have to tackle a problem at work, when you have to go for an interview, when you take a test, when you take an important decision. And in fact, anxiety is beneficial. This is something I'll be talking again in the stress performance cycle as well. Like, for example, anxiety helps us notice dangerous situations. To give you the most basic example, when I'm crossing the road, I look to the left and to the right just because I'm anxious. If I wasn't, I would walk without considering the risk, and I might get into an accident also. So, normal anxiety is good. Normal anxiety keeps me prepared, and so I stay better. But anxiety disorder becomes a problem which goes beyond the regular nervousness and the slight fear that you feel time to time. It is called as a disorder, like I said, when it interferes with your ability to function. So, for example, patients come to me saying that I can't work, I can't focus, I can't remember, I'm not able to talk with my loved ones. You often overreact when something triggers your emotion. You become excessively angry, or you're so scared that you lock yourself inside the house. You can't control your responses to situations. So when it becomes extreme is when we call it as a disorder. So who is at risk? Is everyone, all the 100% of the population, going to get anxiety disorder? No. People specifically with certain traits are actually at risk, like shy, introvert, timid people, people who have not interacted much with other people, who have stayed indoors more. They are going to face anxiety more commonly, and that's natural because your experience with the world is minimal. And when you're going out now, you're going to start experiencing a kind of fear. And those who have experienced childhood trauma, physical, sexual, they very commonly, when they experience the world again, have a lot of anxiety, which turns into an anxiety disorder. Those who have a family history of anxiety and other mental health conditions can also commonly experience anxiety disorder, while others related to heart or thyroid conditions can experience anxiety as well. Let's look at the types of anxiety disorder. There are multiple types, and different types have different signs and symptoms. A brief overview of the types would be generalized anxiety disorder, which is very general. It just contains a lot of restlessness, nervousness, and it needs to be present for at least 6 months before we diagnose it as generalized anxiety disorder. The second type is panic disorder. As we know, there is a concept of panic attack, which looks very similar to a heart attack, but it is normal in every way. The ECG, the heart checkup comes out normal, the blood test comes normal. But in that moment, in those few seconds, we experience a lot of distress. If we continuously get panic attacks, it is called as panic disorder. Then comes phobia, a specific phobia of maybe dogs or maybe of a particular situation is called as phobia. The extent of fear determines whether it is a disorder for phobia or not. Then comes social anxiety disorder. Again, social anxiety disorder is a disorder where you are scared of going out. You don't experience the world safe. Similar to it is agoraphobia. You have the fear of going out. You feel that something wrong will happen. So you don't leave your house. Separation anxiety, very common for children, common in adults as well. When you don't let someone leave you and you hold on to them. The last two types are quite common and something that you all must have heard on a day-to-day basis. OCD, obsessive compulsive disorder. You have an obsessive thought of doing something, and then until you do it, the compulsive behavior, you become very anxious. And lastly, PTSD, post-traumatic stress disorder, a condition where there was a life-threatening situation that you experienced or a childhood trauma that you experienced, which now gives you flashbacks of the same event and makes you feel very anxious. The common interesting part about anxiety disorder is it can affect anyone from children to elders. And how do children experience anxiety? It's normal for children to feel some amount of anxiety, worry at certain points. For example, a child might feel scared of thunderstorm or a barking dog. A teenager might get anxious about an upcoming test or a school dance. But sometimes children approach these situations with overwhelming dread, or they can't stop thinking about all the fears tied to these events. It may seem that none of your comforts help, and these children often get stuck on their worries. They have a hard time doing the daily activities like going to school, playing, falling asleep. They're extremely reluctant to try something new. And when you think about your child's anxiety level, getting stuck is the key. It separates the regular worries of childhood, which is very normal, from an anxiety disorder which requires professional help. So, if the anxiety or worry interferes with a child's ability to function, it is time to seek help. Now comes the stress cycle, which is important to understand because this is how you go into anxiety and this is how you can stop from going into anxiety. So it starts with too little, a kind of phase of bore out when you're not doing anything at all. So that is the reason why when someone is not doing anything, we suggest them to have some form of activity, whether it's mental or physical. And when you keep drifting aimlessly, completely bored, it can be fun for a while, but eventually it is not good for your health. The optimum point is where your body's stress response releases the hormones of adrenaline and cortisol, which helps you perform your best. And because of this, your vision is sharper, your hearing is more acute. Your fight and flight response helps you deal with the short term stress, and you're optimally adjusted well to the environment. But sometimes when you take too much of pressure, you unnecessarily become stressed out about it, and thus your performance starts reducing. Then it exceeds the comfort zone, and fatigue and errors start coming in. Frustration, anxiety, poor concentration, and shame about not being able to do it takes over. And when this becomes extremely high, you go in the stage of burnout. So from bore out to burnout, you experience chronic stress, and this eventually leads to the fight and flight response, which we all know is the most basic instinct we all humans have, and that leads to anxiety. So let's understand the causes of anxiety. Why does anxiety disorder happen? Anxiety disorder are like other forms of mental illnesses. They don't come from some personal weakness, character flaws, or problems with upbringing. A lot of people, they blame it on the person. They say that you're not eating well, you're not eating sugar, you should go and get exposed to sun and such things. But these are external things, and anxiety is a very internal thing. It's related to a chemical imbalance, which can happen due to long lasting stress. And what I'm talking about, the chemical imbalance, is the imbalance between serotonin and dopamine. The environmental factors can also cause anxiety. For example, experiencing a trauma, like we have discussed already. And yes, most commonly, there can be hereditary reasons. You can have anxiety in your family, which eventually can come into you as well. The chances of developing through heredity, though, are very less and very insignificant. So, coming to understanding the signs and symptoms of anxiety, the physical symptoms can be defined as having cold or sweaty hands, dry mouth, palpitations, nausea, feeling numb, tingling sensations in your hands or feet, muscle tension, and shortness of breath. This is classically described as a panic attack if it happens within a few seconds and goes away after a few minutes. There can be some mental symptoms where you feel panic, you fear, you become uneasy, you get nightmares when you're sleeping, repetitive thoughts or flashbacks of traumatic experiences, and uncontrollable obsessive thoughts. And then can be behavioral symptoms as well. You can't stay calm, you can't be still in one place. You have to do some ritualistic behaviors like washing your hands, and you have trouble in sleeping. When a patient comes to a psychiatrist, how do we diagnose anxiety disorder? How do I know that even though the patient is complaining about anxiety, it is a disorder? So this is one of the commonest questionnaire that we use. We ask these questions to the patient from 1 to 14, and we mark them from 0 to 4, between not present to very severe. And this gives us an idea on the level of anxiety that the patient has and whether the anxiety is present or not. So, coming to our last part of the presentation, as we understand, there are two ways we can go about the treatment. The basic first idea to go about is psychotherapy. It is one of the most effective forms, and CBT is the most commonly used. It is structured, goal oriented, and didactic therapy. It focuses on helping people identify and modify the characteristic maladaptive thinking, which I call as negative thoughts, which are kind of like a pattern and belief, and it triggers in developing symptoms of anxiety. So, CBT focuses on building the behavioral skills, and thus patients can behave and react more adaptively to anxiety producing situations. Usually, when a patient comes to us with a mild to moderate anxiety disorder, we start with counseling and psychotherapy, and that works slowly. And over the few months, the patient comes out of anxiety. But medicines are also an option. A lot of people have pill shaming. They don't prefer taking medications. They feel that this is not a problem, this is just a thought or someone thinking on purpose about this. You can't will it away. It is not a matter of self discipline or attitude. It will not go away just by thinking or becoming, trying to become strong. It requires support and it requires treatment. So medicines work very well. There are two kinds of medicines that work. The first one are pure anti-anxiety medicines, which we call them as benzodiazepines. They induce a bit of sleep as well. The options in benzodiazepines include etiozolam, clonazepam, lorazepam, nitrazepam, while there are these other class of drugs called as selective serotonin reuptake inhibitors, which normalize the chemical balance and thus you come out of anxiety disorder. Examples include paroxetine, escitalopram, fluoxetine. The last part, prevention. Can anxiety disorder be prevented? Can it be stopped before it comes to you? You can prevent in a way, but it is not something that you can definitely prevent. Sometimes it occurs without any realization, without any control. Maybe you're having the perfect lifestyle, you have never taken stress, you're working very well, and still you got it. Yes, chemical imbalances can happen randomly as well, but if you take certain precautions, then the chances of you developing anxiety disorder is negligible. Make sure you talk to your doctor before taking any kind of medication. Nowadays, particularly after COVID, people have been taking medicines without asking the doctors, and some of them contains some components which makes anxiety worse. Preferably don't have any coffee, any caffeine, tea, cola, chocolate. Also, smoking and drinking and other kinds of psychoactive drugs are going to cause anxiety. Healthy lifestyle is a must. Exercising regularly, eating a healthy, balanced diet is very important. And yes, at the first point of feeling anxious, stressful, seek support and make sure you resolve this stress. Doing so can prevent anxiety and other unpleasant feelings from disrupting your life. So, to conclude, anxiety disorders can often go undiagnosed and untreated. Fortunately, treatment can help. The right treatment can help improve your quality of life, your relationships, your productivity. It can support your overall well being, and you don't need to live with constant worry or fear. If you notice symptoms of anxiety, talk to your doctor, to your psychiatrist, to your psychologist, to anyone who is a professional. It's best to get diagnosed and treated as soon as possible because this is a condition which is definitely curable, treatable, and it will not come back as long as you maintain a combination of medication and counseling and you come out of this effectively. Thank you for listening, and I welcome any questions. This is my Instagram ID, which y'all can follow to get small tidbits about mental health. And y'all can even ask me anonymous questions if you want on it as well. Those who don't want to ask right now on this forum. Thank you again.
Thank you. Thank you, Dr. Rahul Khemani. Excellent presentation. I would like post the slide so that we can see the okay. Dr. Angelica, please go ahead with your question.
Thank you so much for this excellent presentation. One of the things that we are seeing in South Africa is the increasing amount of young children around about the age 6, 7, starting to come in with anxiety symptoms, and sometimes very difficult to convince the parents that this is not the child's heart or whatever, that this is actually anxiety disorder that the child is suffering from, and that one needs to treat it. So the question is, actually, it's quite difficult to treat those young children because we don't really have medication for, or enough medication on the market. What would you suggest again We try to send him to the psychologist for, and to tell the parents what to do, but sometimes very, very difficult. And medication is a problem. If you can just maybe comment a bit on that. Thanks.
A very good point that you have raised, and I agree with you. And to this thing, I would say that we should try some group counseling sessions. In that sense, the awareness improves for those children who are not visiting the counselor. In group counseling, the benefit of group counseling is that each child helps raise the other child as well, and helps the other child realize that this is quite a common problem and something that we should talk about freely. And that also reduces the problem of individual counseling time, and this can cover more area in that sense. Otherwise, those children who require medications can definitely visit a psychiatrist and start with treatment, and that would also be quite beneficial. There is a specific line of treatment particularly made for children, which is very safe, and it can help the child recover quickly.
Chong, would you like to take it forward? Rahul, we have a question in the chat in the Facebook. It says, how do you differentiate between depression and anxiety, and at what stage it needs to be alerted?
So, yes, theoretically, we describe anxiety and depression separately. Anxiety is more a feeling, and depression is more a mood, but both are related to the same chemical of serotonin that is imbalance in the brain, and thus it leads to either anxiety, which is a state of nervousness, or depression, which is a state of low mood. So we can sometimes even some people think of it as a mild condition would be anxiety, and a severe condition becomes depression. But usually both of them are concurrent and they happen together. In either sense, the treatment is also quite similar. In both the conditions, we give medications related to increasing the serotonin levels, and thus it's not anything scary or anything. Maybe if I get an opportunity, I might do a small presentation of depression as well, and that way you will be able to clear out your questions on depression as well. But otherwise, depression, even though it sounds very scary, it is not. It is a condition which gets resolved very quickly and very effectively.
Yeah, we would love to have a session on depression. I think that is also one of the need of the hour for people to know. And the main factor is people don't like, in terms of depression, people really don't, they try to hide if they're into depression. It is just a disease. It is not something which, just like in another disease, it's like, you are having it and it's not a harm to go to a doctor and get it cured. But people are very shy, they're very scared, and that is what causes the stress. And that is where people try to avoid talking to others. So I think this is a very important topic as well, which we need to cover.
Absolutely, absolutely. So I'm actually happy that someone did ask about this question, because that actually clears that question for a lot of people.
Do we have any other questions on the floor? And Dr. Chong, Dr. Wazik, are you there? Dr. Sajad, please go ahead with your question.
Okay, thank you very much, Surab. It was excellent presentation by Dr. Rahul. I missed some of the point, but I would like to know that most of the Dr. Rahul, most of the doctors, the psychiatrists are preferring to consult with the anxiety patient, not prescribing any medicine. This is my observation. Is it correct, or when it is needed for medication? This is my question, please. Thank you.
So I agree with you. Since the newer generation psychiatrists have come, they have made themselves proficient in therapy as well. And we are starting with therapy more and more to allow the patient, to allow them an opportunity to overcome this anxiety before we start with any medication. Because as we understand, anxiety is because of a pattern of negative thoughts, because of certain maladaptive negative thoughts. And this is something that can be identified, and this can be solved without medication as well. But if it is severe, then ideally it is suggested to start with medications, because prolonging is unnecessarily delaying the inevitable and leading to more complications. So therapy works, yes, but a combination of therapy and medication is ideally suggested for moderate to severe anxiety.
Okay, thank you very much. I have another question that I can't see you. Your your picture is not visualized. I mean, no video of your picture.
Yes, actually, it's not working smoothly. My internet connection is a little weak right now, so that's why I've focused more on the audio more.
Audio. Okay, thank you. No problem. Okay, thank you.
Dr. Rahul, there's another question which says that in this recent time, we have seen an early anxiety or a early depression. Again, people are getting confused between anxiety and depression. The questions are coming in the same manner. But there is the parents are concerned about the early anxiety between the kids. At what age group it is generally seen, and at what age group it is getting increased, and what should the parents do when they see a sign of anxiety or stress happening in the kids. Especially, I think when we talk about kids, they are talking about either education, or they are talking about the comparison with the other kids which they watch to each other. So I think that is one of the things which we are seeing in this generation.
Another good question, and I would say that there is no age limit. There are people who bring their 1-year-old child to me as well, thinking that the child has anxiety. And there are people who are coming at the age of 90, 95 as well with anxiety. So there is no age limit for having anxiety. Children are, as I had already spoken in the presentation, very prone to develop anxiety because they're constantly put to some or the other stress. But the point is getting stuck. If you see your child is stuck somewhere, not moving ahead, not moving back, that is the problem, and that is when you should take to a professional. Sometimes, yes, you can help the child, maybe taking a small vacation, maybe sitting with the child and talking with them, letting them express themselves is something that helps as well. But in most of the conditions, allowing them to relax, because it's become a very competitive world post COVID, particularly, and with our ever increasing population as well. So, yes, we need to give more time, and we need to let children decide what they want to do and not pressurize them.
Also, have we seen any study where anxiety is leading to the other health problems, and like early blood pressure or early diabetes or something like that?
Extremely common. In fact, this is something that is the reason why physicians usually refer patients to psychiatrists, because if you don't control the anxiety, the blood pressure and diabetes doesn't come under control. In fact, a lot of times in my practice, I've seen that with control over anxiety, there is a complete reversal to hypertension and diabetes as well. So this makes completely now a thing that can happen if you take care of your anxiety well. Yes.
Thank you so much. Also, when you sweat during the anxiety, and I think sweating is also one of the reasons where in the old age, especially post 40 or 50, it also is a symptom of somebody having a heart attack. So is there something where people can differentiate in terms of how do you differentiate that, okay, this is an anxiety stress? Or
So sweating is just one part of it. There are multiple other symptoms as well. If you speak of the symptoms, the most common ones are usually palpitation, that is increased heartbeat, and breathlessness, and feeling like you're going to, an impending doom, kind of like you might end, is the most common. Then comes the sweating, tremors, numbness, cold hand feet, and all. So there is no way to differentiate between a normal sweating and a anxiety related sweating. But yes, there are young adults coming to me complaining that they have an excessive amount of sweating without any control and not associated with these other symptoms, and it usually occurs in social situations. So even those improve with counseling, that is therapy, CBT, as well as with medications as well.
thank you so much. Do we have any other questions on the floor?
Sorry, Saurabh, not really a question, but just to comment as well. So, regarding the children, you know that at certain, you know that at the age of, let's say, 5, 6, you're not really supposed to see children coming frequently to the surgeries as when they were 1 year, 2 or 3 years old. So you look at for something that's out of the pattern. And with children, it is those children coming in complaining of constant stomach pain. It's always related to the stomach, or headaches, or also the mother brings a child and says the child is fatigued, or there might even be problems, behavior problems in the school setup. So then you start to think about mental type of disorders, and not so much as a heart. There's maybe something wrong with the heart or the lungs, if you follow my drift. So, and then with teenagers, there's also a teenager doesn't come to you on a regular basis with, again, the same sort of type of complaints. That age group's very seldom visits the doctor. So the moment when they start to visit you often, this is a red light going off and say, wait a bit, there's something else going on. So, and very seldom they will say to you, I am afraid of something. It's the type of symptoms, as Dr. Rahul explained, that actually leads you to make those diagnoses. I hope this clarify a bit. Thanks.
Thank you for your comments. I think, Dr. Rahul, I will just ask you the last question. Can you comment on post-COVID, anxiety, which people are coming to you? Like, we want to have an experience of COVID patients, as there are a lot of people who are having symptoms after even 1 year, 2 years of the COVID.
So COVID, to begin with, was a period of uncertainty, a lot of scare. People were scared seeing deaths. People were scared that for the first time ever, there is something for which doctors are not able to do much. And that has created a kind of a threat to the existence itself, and that naturally is very stressful, which automatically makes people feel very scared. uh, that enforced certain rules and regulations to people. People started wearing masks, and they started maintaining social distancing and everything. So, kind of, one, the life changed because of it, and that automatically led to a lot of adjustments to be done, and automatically a lot of anxiety because of that. Secondly, because of COVID itself, uh, for which the pathophysiology is yet to be determined, a lot of people post COVID have experienced a different form of anxiety. Some people call it as brain fog as well. This kind of anxiety is not something that gets better with simple anti-anxiety medications, and it takes even longer to get better from it as well. So, somewhere COVID has been affecting the brain in the recovery process. It makes you physically exhausted as well, which again adds on to the anxiety bit. But otherwise, it is just like any routine, regular anxiety only, and something that definitely can be treatable. But it would be something that would not happen if you would be confident enough that yes, you're taking care of yourself. So now COVID won't come back. Yes.
Welcome, Dr. Chong. Finally, we see you. And over to you.
Dr. Khemani, thank you very much for that wonderful presentation. I think anxiety is something that we see very common in a lot of our patients. Can I just ask if because of COVID, we had a lot of losses. A lot of people lost their freedom, lost their travel, lost their independence, economic losses. A lot of people lost their family members as well. And so with all these losses and this huge grief reaction that the whole population underwent, what are your thoughts, like anger, denial, bargaining, sadness, acceptance?
Exactly. COVID made things very difficult in every aspect for every person. And that turned out to be a very gray area in a person's life. Grief became difficult because people did not have someone they could properly give an ending as well, and that again became very difficult for people. But slowly life has almost come back to normalcy, but people are not able to forget it, particularly those who are in the midst of COVID. But it will take its own time, and people will take its own speed to recover gradually.
Is there, Dr. Khemani, is there a risk of this grief reaction sometimes being sort of like stuck, or, as you mentioned earlier on, some sort of process
That's
based? Yes.
That's a concept called as pathological grief. So normal grief does stay for a few weeks, 2 months, but when it extends beyond 6 months to a year, then we call it as a pathological grief, and that's the problem, that they are not able to stop thinking about their loved ones, and they still are unable to get back to your daily functioning.
Would you say, Dr. Khemani, would you say that a long COVID in its form has some of this anxiety, some of this grief reaction, some of this stuck grief reaction or pathological grief reaction inside it as well?
Definitely, definitely. As we understand, COVID was related to certain neuroinflammatory situations as well, and that has caused some changes in the pattern of the thinking, which eventually has led to people to feel constantly anxious.
Thank you. There's a very nice example. I remember one of my friends described it a long time ago as the mind being a lake and things bubble up. And in anxiety or obsessive compulsive situations, what bubbles up is not just gas or a dead rat or a Coca-Cola can, but rather a dead body rises up to the lake, the mind lake. And the patient sees the dead body on the mind lake and has a very bad feeling. And goes to do something about it. So it's also like an obsession and then a compulsion, and then the whole thing becomes a vicious circle.
Very true. I actually find this example very apt.
I've always used this example to describe this to my patients who was facing some sort of anxiety and OCD, and they find it a very useful way and I always tell them you have to break the vicious cycle, because that action, the compulsion, the obsession and the compulsion drives the cycle, and actually the whole idea behind a lot of the therapies is to break the cycle.
Absolutely, absolutely. It is a cycle that can be broken and something that can be completely recovered from.
Perhaps you can also tell us a little bit about, in the context of what I've just described, how does, what CBT does in this aspect of breaking the cycle?
So CBT works on the maladaptive thought patterns, or in our simple words, we say as negative thoughts. So there is a way of thinking that develops over the long run, which makes you think that something, for example, one of the thought patterns would be that something worse is going to happen. And we constantly think about that. And because we are constantly thinking about that, it's a self-induced anxiety, even when things are normal outside. And that automatically leads to kind of a disorder. So identifying that and trying to stop it, it is like a practice. That's the behavior regulation of CBT that eventually works to control anxiety. That's why it takes quite a long time to work.
Yeah. Thank you very much, Dr. Khemani. Most enlightening. And do we have any more questions from the floor about anxiety disorders?
I think the questions for our viewers. I also see some school joining in. Very, that's a very nice thing. I think kids are joining in. So, any take-home message for our audience?
Okay.
Definitely. I would say,
Saurabh, can I say something?
Yes, Dr. Sajjad.
Yes, Dr. Sabha.
Yes. Actually, I'm just want to appreciate Dr. Chong, because when I see him, I become fresh, energetic, and very active. So thank you very much, Chong. You are always very refreshing for us.
Pleasure's mine, Dr. Sajjad. Dr. Khemani, your take-home message for us?
yes. So I was
Thank
saying
you.
that these conditions rather, are conditions which are definitely treatable. People consider mental health disorders as very scary and irreversible, and they don't come for treatment thinking that it would be a shame to their families or to their society or something. But that's not true. Mental health is a true health, which is part of your general health. And sometimes, yes, there can be difficult days. Like we say, it's okay to be not okay sometimes. But this is something that we can treat, and you can recover, and you can become absolutely uh, comfortable in your life again. So choose to get better whenever you get the opportunity. Thank you, everyone.
Thank you, Dr. Khemani. And, rightly so, you are correct, because there remains stigmatization of, seeking psychiatric help, professional help, everywhere in the world, especially in less developed societies and so on. I think in more developed societies there is more understanding, big cities and so on, they're more understanding that this is just, another illness that doctors can help you with. But certainly there's a lot of stigmatization that we still see in Asia, and amongst our midst. I think this is not easy to overcome, but yes, it is a definite important point that you have made, that we should overcome this stigmatization and let people get the help that they deserve, and for their lives to to get better. So yes, and thank you very much. And without much ado, Sarab, are we good to?
Yes, Dr. Rahul. I think my team will contact you for a relevant topic of depression. I think I see there are a lot of questions on depression, and people do get confused between stress, anxiety, and depression. And I think they all are so closely related that it is not something which the general public will understand. And also, I believe that everyone who has facing through all these problems should talk to a professional. People are available to help you. You can talk to your parents, you can talk to your family members, or professionals like Dr. Rahul Khemani they are available for all your answers. You can, if you have any further questions, please do write us and we will be happy to respond. See you again, and happy journey.
Thank you.
Thank you,
Thank you,
everybody.
Raj.
Thank you.
Thank you, Dr. Kamani.
Take care, everyone. Take care of your minds as well.
Thank you very much.